Hi, welcome to the Spine MDT. This video is about fractures of the spine, predominantly traumatic fractures, or what we call insufficiency fractures as well. So fractures secondary to either osteoporosis or osteopenia, where you've got weak density of the bone, but also fractures caused by direct trauma, how they're managed. Perhaps you've had a fracture, been given advice, or possibly due to have an operation, or you've been put in a brace. So we're going to go over them today. So my name's Anthony Gosh. I'm a consultant neurosurgeon specialising in spine disease. Click the link to subscribe to the channel. You can stay up to date with all videos I post related to spine problems, back pain, and things like that. Also, click the link below for access to our blog and videos, which we post frequently on education and problems with the spine that you might find helpful. So keeping it simple, there are basically two types of fractures you get in the spine. One caused by direct trauma or injury to the spine, and the other caused by an underlying disease of the spine, what we call a pathological fracture. So things like tumours in the spine, infections or problems with the bone density of the spine, and then you can have combinations of the two. For the purpose of this video, it's predominantly on trauma to the spine, with or without underlying bone density disease such as osteoporosis or osteopenia. It takes a fair bit of force to cause a fracture of the spine. It usually happens from vertical loading, so a fall from a height landing vertically, or high-speed road accident collisions, where these compressive forces cause a bone to fracture. So here we have a CT scan of the spine. This is a midline slice right down the middle of the body. This is the back, this is the front. The spine, as you know, is made up of vertebral bodies, and this block here is crumbled down, as has this one. And this is a very common location here, somewhere in the junction of the lumbar spine, the lower back, and the thoracic spine, the upper back, where you've got a segment of the spine that's braced by your rib cage. It's not very mobile normally, and the junction of that and the lumbar spine, which is a bit more mobile, this is the area that's a bit more vulnerable to these forces. Likewise, the cervical spine is another common area, so the neck area of the spine, and again that's the next part of the spine that's quite mobile, and forces where you've got rapid extension, cocking back of the neck, or flexion, cocking forward of the neck, can make this area vulnerable to fracture. So here we've got an MRI span showing the cervical spinal cord. Here is the back, this is the front, and this area here of brightness is a rupture all the way through the disc space, a kind of rupture or fracture through the disc, making this segment unstable and making the spinal cord vulnerable. So the treatment of these fractures usually depends on how unstable that fracture is, and therefore what is the risk of it causing damage to your spinal cord or your nerves, or if you've already got some damage or signs of neurological symptoms. And then the other thing is, and the other reason to treat it is if you've tried to manage it conservatively and things are just getting worse, you can't manage the pain. So in the acute setting or the emergency setting, that decision will be made between the emergency doctors seeing you in discussion with the neurosurgeons or spinal surgeons in that unit, with a review of your scans and your clinical signs and symptoms, specifically neurological signs and symptoms. Depending on what the fracture looks like on the CT, if it doesn't look unstable and you don't have any signs of spinal cord or nerve injury, quite often the fracture can be managed in a special type of corset or a brace like this one, which restricts some of the motion around the spine, stops you bending in this area, and also that in itself helps give you some vertical loading support. Generally, the advice, if it's felt stable enough to wear one of these and not have surgery, usually the advice is you can wear this usually when you're upright, and then you can take it off in bed at night, and you're often given instructions on how to clean your skin underneath it. In the cervical spine, again, sometimes a fracture may be deemed relatively stable and can be managed in a collar like this. Because the cervical spine is a little bit more complex, you've got the spinal cord there, it's a bit more vulnerable. The instructions are very specific, so it's important to be guided by the team who've advised it. So if you're fitted in a collar or a brace, we often keep an eye on you with x-rays at close intervals, and what we're looking for is any collapse of the segment, which you can see has happened here. This is one of the vertebral bodies that's completely wedged over time, and in these scenarios surgery may be required. So you can see here this patient has had a side view here, a construct of screws and 2 rods to kind of support that segment and then restore its height. Surgery like this, and this is a front view of the screws and the rods holding it all together. Surgery like this can usually be done through what's called a minimally invasive method, where very small incisions are made just for the screws to enter through the skin for a tiny little slit. And with X-ray guidance or image guidance, we're able to navigate the screws exactly where we want them. Once the screws are in, you lock or join the heads of those screws together with 2 rods to reinforce it. Sometimes cement is required to surround the screws if the bone's not of great quality, to give it that extra security. If at the time of the injury the scans show the fracture to look quite unstable or some of the nerves to be compromised, so you can see here in this spine, this is the back, this is the front, this bone here is completely crumbled down. You've got this fragment poking backwards into the canal where the spinal cord is, and also a second bone here has collapsed. This is highly unstable and this patient has some deficits. So here's an example of screws and rods again placed to restore the alignment, create space here in the canal to help this patient recover. Likewise, in the neck or the cervical spine, fractures like this are quite unstable. There's often quite a lower threshold, in fact, to operate. So here's an example where we're actually going through the front of the neck, remove the disc and any blood that might be compressing the spinal cord. Replace the disc with a fusion cage, which allows the bones to join together over time and fuse. And then here's some screws and a plate locking it all together. Now, often fractures can happen with very little force, if any at all, in patients who have low bone density, where the bones are not as tough or as hard as they should be, from conditions like osteoporosis, osteopenia. I've done a whole separate video on that. There's a link below. And in that scenario, often it heals on its own, but there is the option of a procedure called a kyphoplasty or vertebroplasty, where a needle is passed into the bone of the spine and some cement is injected inside it to harden that segment and allow it to heal over time. There's a link to that video below, so I hope you found that helpful. If you've had a fracture, it's very important to stay in touch with the team that diagnosed it or the spinal team that have given you advice about the brace to wear. And all the follow-up that's required. I've often given opinions to people who come to see me having had a fracture, been put in a brace, but unfortunately couldn't get hold of the team. I'm happy to do that, but it is really important that for continuity that the team that treated you do actually see you. The goal of the Spine MDT is to find the least invasive solution that also gives you the longest lasting result, and we are able to do that by being one of the few practices that works with a whole team of professionals that deal with spine disease, including chiropractors, osteopaths, physiotherapists, pain specialists, as well as surgeons working together to deliver that result where you have oversight of your care by a surgeon. To find out more, visit us at spinemdt.com. You can send us an email, make an inquiry at info@spinemdt.com. Please visit the website or call us on the number below, and we'd be very happy to help you. Thank you.